I've talked while we were going through that about how it impacts workers in real life. I want to give a little bit of numbers about what it means for LA County. There are approximately 184,000 consumers of this service in Los Angeles County. Los Angeles County represents 40% of in-home supportive services program in the state of California. The 8.4% cut affects all 184,000. The elimination of domestic and shared living services will affect about 63% of that workforce. 115,000 consumers would lose care. They would essentially be put on some waiting list and would have to go, the social workers and the union, frankly, would be responsible for having to go out and try to find another 115,000 people who could provide this care, who don't live with the consumer, or get the consumer get the provider who only makes $9 an hour to move out of where they live and go and find an affordable place, apartment or a place to live in Los Angeles County on $9 an hour. 115,000 people. The physician certification affects about 20,000 consumers who would that are on the Medi-Cal program, who would have to then use one of their 10 visits to actually go and get their physician certification for the program. This is not a small. Gene said that the governor couldn't cut around the edges. IHSS, in relative terms, is a small program. It's funded 3 ways. 50% by the federal government. It was 60% under the that thing, the Recovery Act. It was 60%. It will, with that program phasing out, it will go to its original 50%. 32.5% is funded by the state government. 17.5% is supplied by counties. So you see, Governor Brown is making declarations, and he's a minority stakeholder in the business. And so it's hard concept for home care workers and their consumers to swallow. And as the presenter before me talked about, the constraints of the Affordable Care Act, I want to now move to what SEIU is thinking about in terms of alternative proposals. While maintenance of effort is viewed as a constraint in the Affordable Care Act, there are many other opportunities that exist in that Affordable Care Act as well, and which is why I think, and SEIU thinks, it's that much more critical for us to protect and defend the Affordable Care Act. Because it not only allows for a pathway of the coverage of 93% of California, it also speaks volumes about moving to home and community-based services and gives states incentives to do that. In a time where states are in financial crisis, the federal government is incentivizing them to move to a much less cost-prohibitive method of providing care to our seniors and people with disabilities. And so, what we have proposed what we're thinking about actually proposing in this next week to Governor Brown and the legislature is one of those provisions in the Affordable Care Act is called the Community First Choice Option. That provision becomes accessible to states as of October of this year. So it fits right neatly into our fiscal year. It allows states to align the delivery of services such that people who are eligible, who are nursing home eligible, if the state provides support and a program and a structure for them to remain in their homes, the federal government will increase their Medicaid rate by 6%, bringing an additional, in 2011, $120 million into the state of California. There are ideas that we have around the nursing home industry in the state of California operates at about a 95 to 98% capacity, beds full. So there's a percentage of beds that remain vacant on a fluctuating basis. So we're proposing to the legislature and to Governor Brown is that you incentivize the nursing home employers to eliminate those vacant beds, thereby making more, because the state pays on all beds, whether they're vacant or not. And so we want them to eliminate those beds and move that money into the IHSS program. There are, and which is hard and new for SEIU because we also represent nursing home workers, right? But this is, Jean said earlier, this is not about what's right for me anymore. It is what is right for California. And we think that the In-Home Supportive Services Program is the program that takes California healthcare delivery well into the 21st century and the way to provide health support for our growing aged population. And that California is uniquely positioned because it has an existing workforce and to be able to deliver home and community-based services in a way that any other state is not positioned. And so we are willing to say, cut this, which we represent, save this, which is better for California. There are a number of sort of smaller proposals that we're making to Governor Brown and the legislature about how they deliver services, the administration of the program, blah, 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 blah. But I think those are the two most significant and represent the union's willingness to put down its, sort of pause its marching and shouting and actually move to a place of shared sacrifice as the governor is proposing. So that is SCIU, that is In-Home Supportive Services.
Thank you.